Welcome to Pigeon Healthy. There's a disease in your loft right now that you probably don't know about. It doesn't cause dramatic symptoms. Birds don't drop dead suddenly. They just slowly decline. Performance drops. Fertility decreases. Young birds fail to thrive. Adults lose condition. And you can't figure out why because the birds don't look obviously sick. You treat for the usual suspects, worms, coccidia, respiratory infections, nothing helps. Meanwhile, the disease spreads silently through your entire flock, destroying your breeding program and racing results year after year. I'm talking about paratyphoid, also called Salmonella, and it's one of the most underdiagnosed and devastating diseases in pigeon keeping. Studies show that 40 to 60% of racing lofts have paratyphoid present in their flocks. Most keepers have no idea because the disease often causes chronic, subtle symptoms rather than acute illness. But make no mistake, paratyphoid destroys performance, kills young birds, causes infertility, and can even be transmitted to humans. Today I'm going to teach you everything about paratyphoid, what it is, how it spreads, the symptoms to watch for, how to get definitive diagnosis, treatment protocols that actually work, and most importantly, how to prevent it from ever entering or spreading in your loft. This is critical information that every pigeon keeper needs. Let's start with what paratyphoid actually is. Paratyphoid is caused by bacteria called Salmonella typhimurium, specifically strains that affect birds. It's related to the salmonella that causes food poisoning in humans, and yes, pigeon salmonella can infect people, though it's not common if you practice good hygiene. The bacteria infects pigeons through ingestion, meaning birds swallow the bacteria, usually from contaminated feed, water, or surfaces. Once inside, the bacteria colonizes the intestines and can spread to other organs including the liver, spleen, joints, reproductive organs, and even the brain. Here's what makes paratyphoid so insidious. Many infected birds become carriers. They harbor the bacteria and shed it in their droppings, spreading infection to other birds, but they themselves show no symptoms or only mild symptoms. These carrier birds look healthy, perform reasonably well, and you'd never suspect they're infected. But they're constantly contaminating the environment and infecting other birds, especially young birds with immature immune systems. A single carrier bird can infect an entire loft over time. The bacteria is very hardy in the environment. It survives for weeks or months in dried droppings, contaminated feed, dirty water, nest boxes, and perches. This means even if you remove infected birds, the environment remains contaminated and reinfects new birds. Breaking the cycle requires aggressive treatment and thorough environmental disinfection. Paratyphoid causes two main forms of disease, acute and chronic. Acute paratyphoid occurs mainly in young birds, typically 4 to 12 weeks old. It causes sudden illness and rapid death. Symptoms include severe diarrhea, often bright green and watery, extreme lethargy and depression, loss of appetite, rapid weight loss, ruffled feathers and huddled posture, dehydration, and death within days to a week. In acute cases, you'll often find young birds dead in the morning with no prior warning. Post-mortem examination reveals enlarged liver and spleen. Both organs are swollen and discolored because the bacteria concentrates there. The intestines are inflamed. Sometimes there are internal abscesses. Acute paratyphoid has high mortality. Without treatment, 50% or more of affected young birds can die. Chronic paratyphoid is more common in adult birds and harder to recognize. It causes vague, nonspecific symptoms that develop slowly over weeks or months. Performance gradually declines. Racing birds fly slower, home later, or get lost. Breeding birds show reduced fertility. Eggs are infertile or embryos die in the shell. Birds lose weight slowly despite eating normally. Feather quality deteriorates. Droppings are occasionally loose or abnormal but not always. Some birds develop joint infections, leading to lameness, swollen joints, inability to perch properly, wing droop if shoulder joint is infected. Nervous system infection causes head tilt, circling, loss of balance, seizures, paralysis. These neurological symptoms are often mistaken for other diseases like vitamin deficiency or head trauma. Some infected birds appear completely normal but are carriers, showing no symptoms at all but spreading disease. Chronic paratyphoid doesn't kill birds quickly, but it destroys your program. Racing performance suffers. Breeding success drops. Young birds fail to develop properly. And because symptoms are subtle, most keepers never identify paratyphoid as the cause. They just accept declining results and don't realize their flock is chronically infected. How does paratyphoid spread? The primary route is fecal-oral. Infected birds shed salmonella in their droppings. Other birds ingest the bacteria from contaminated water, feed, or surfaces. Young birds are especially vulnerable. They explore their environment, peck at everything, and have weak immunity. A few contaminated droppings in a young bird pen can infect the entire group. Adults can also spread paratyphoid sexually. Infected cocks can transmit bacteria to hens during mating. Hens can pass infection into eggs, so squabs hatch already infected. This is called vertical transmission, and it's why treating breeding stock before breeding season is so important. Paratyphoid also spreads through contaminated equipment. If you use nest boxes, perches, or transport crates from an infected loft without disinfecting, you introduce the bacteria to your loft. Wild birds, especially sparrows and starlings, carry salmonella and can contaminate your loft if they gain access. Rodents also carry and spread the bacteria. How do you diagnose paratyphoid definitively? You cannot diagnose based on symptoms alone because symptoms overlap with many other diseases. Definitive diagnosis requires laboratory testing. The best method is bacterial culture of droppings or cloacal swabs. Collect fresh droppings from multiple birds, especially sick birds or birds you suspect are carriers. Send samples to a veterinary lab that does avian bacterial culture. The lab will culture the sample looking for salmonella growth. If salmonella grows, they'll confirm it's Salmonella typhimurium and often do antibiotic sensitivity testing to determine which drugs will kill it. Blood tests can detect antibodies to salmonella, showing the bird has been exposed, but antibodies don't prove active infection. A bird can have antibodies from past infection but no longer be infected. Culture is more definitive. Post-mortem examination of dead birds showing typical lesions, enlarged liver and spleen, intestinal inflammation, can strongly suggest paratyphoid, but culture confirms it. If you suspect paratyphoid in your loft based on symptoms like poor breeding results, declining performance, occasional green diarrhea, young bird deaths, I strongly recommend testing. Don't guess. Get lab confirmation. It costs $50 to $100 but gives you certainty about what you're dealing with. Now let's discuss treatment. Paratyphoid is bacterial, so it requires antibiotics. But not just any antibiotic works because salmonella can be resistant to many drugs. This is why sensitivity testing is valuable. The lab tells you which antibiotics will work. Commonly effective antibiotics include enrofloxacin, a fluoroquinolone antibiotic, very effective against salmonella. Typical dose is 10 to 20 milligrams per kilogram body weight once daily for 10 to 14 days. It can be given in water or individually to each bird. Trimethoprim sulfa combination, also effective, given in water for 10 to 14 days. Follow product instructions for dosing. Amoxicillin clavulanic acid is effective against some salmonella strains. Your vet can prescribe this in appropriate dose. Doxycycline is sometimes effective but salmonella can be resistant. Use only if sensitivity testing shows it will work. Treatment protocol requires treating all birds in the loft simultaneously, not just the sick ones. Remember, many birds are asymptomatic carriers. If you only treat sick birds, carriers remain and reinfect the flock. Treat everyone. Treatment duration must be at least 10 to 14 days, sometimes longer for chronic infections. 7 days is not enough. The bacteria hides in tissues and requires extended treatment to fully eliminate. During treatment, you must disinfect the environment aggressively. Clean out all droppings, old bedding, debris. Scrub all surfaces with detergent and water. Then disinfect with a product that kills salmonella. Bleach solution, 1 part bleach to 10 parts water works well. Spray or wipe all surfaces, let sit for 10 minutes, rinse. Quaternary ammonium disinfectants are also effective. Follow label directions. Replace all nest material, bedding, and perches if possible. If you can't replace, soak wooden items in disinfectant solution. After treatment, retest birds to confirm elimination. Wait 2 to 3 weeks after finishing antibiotics, then collect droppings and retest by culture. If salmonella is still present, you need another round of treatment, possibly with a different antibiotic. Some chronic infections require multiple treatment rounds to clear. Even after successful treatment, some birds remain carriers. This is the frustrating reality of paratyphoid. The bacteria can hide in the gallbladder or other organs, and birds intermittently shed it. These birds test negative sometimes but are still carriers. This is why prevention and ongoing monitoring are so important. Can paratyphoid be prevented? Yes, but it requires diligence. First, quarantine all new birds strictly. Any bird entering your loft from outside should be isolated for at least 4 weeks. During quarantine, observe for symptoms and ideally test droppings for salmonella. Only introduce the bird to your flock if healthy and testing negative. Second, never share equipment with other lofts unless you thoroughly disinfect it first. Borrowed crates, nest boxes, anything that contacts another loft's birds is a risk. Third, exclude wild birds and rodents from your loft. Seal entry points, remove nests, trap or poison rodents. Wild animals are disease vectors. Fourth, maintain extreme hygiene. Clean droppings daily. Change water daily. Disinfect waterers and feeders weekly. Keep feed stored in sealed containers so it can't be contaminated. Fifth, test your flock periodically even if birds appear healthy. Annual or biannual Salmonella testing catches infections early before they spread. Sixth, treat any confirmed infections aggressively and completely. Don't use short antibiotic courses or treat only a few birds. Do it right. And seventh, optimize immunity through excellent nutrition, low stress, and parasite control. Healthy, well-fed birds with strong immunity are more resistant to Salmonella and less likely to become carriers. Let me share a case that shows how devastating undiagnosed paratyphoid can be. A racing loft had declining results over 3 years. Birds that should have won were placing mid-pack or getting lost. Young bird performance was especially poor. The keeper treated for respiratory disease, worms, coccidia, tried different feeds, nothing helped. Frustration was extreme. Finally, I suggested Salmonella testing. We collected droppings from 20 birds and sent for culture. 15 out of 20 tested positive for Salmonella typhimurium. 75% of the flock was infected. The keeper was shocked because only a few birds showed any symptoms. We implemented full treatment. Enrofloxacin in water for 14 days for all birds. During treatment, complete loft disinfection, everything scrubbed and bleached. After treatment, we retested. Still positive. We did a second round with a different antibiotic based on sensitivity results. Retested again. Finally negative. The following racing season, performance transformed. Birds that had been mediocre were suddenly competitive. Several won races. Young birds developed faster and performed better. The keeper said it was like having a completely different team of birds. Same genetics, same training, but without the chronic Salmonella infection dragging them down. Another case involved a breeding loft with terrible fertility. Hens laid eggs but most were infertile or died in shell. The few squabs that hatched often died within 2 weeks. Over 2 breeding seasons out of 30 pairs, they raised maybe 15 squabs total. That's a disaster. Testing revealed widespread paratyphoid. We treated all breeders with 2 rounds of enrofloxacin, 3 weeks apart. Disinfected everything. Waited 1 month after treatment, then started breeding season. The next season out of 30 pairs, they raised over 100 squabs. Fertility was normal, hatch rates were good, squabs survived. The paratyphoid had been destroying eggs and killing babies. Once eliminated, everything worked. These cases are not unusual. Paratyphoid is incredibly common and incredibly damaging, yet most keepers never test for it. They struggle with poor results for years without knowing why. If your loft has unexplained fertility problems, declining performance, occasional young bird deaths, chronic issues that don't respond to standard treatments, suspect paratyphoid and test. It costs $100 to test. It might cost a few hundred more for treatment. But the improvement in results is worth thousands. Here's your action plan. First, if you've never tested your loft for paratyphoid, do it now. Collect fresh droppings from 10 to 20 birds, especially any that show symptoms, and send for Salmonella culture. Second, if you test positive, treat aggressively with appropriate antibiotics for full duration. Treat all birds, disinfect environment, and retest to confirm elimination. Third, implement prevention measures. Quarantine new birds, exclude wild animals, maintain hygiene, test periodically. Fourth, if you have chronic unexplained problems in your loft, poor breeding, poor racing, consider paratyphoid as a possible cause and test. And fifth, educate yourself about disease prevention. Paratyphoid is just one of many diseases that can devastate a loft. Good biosecurity, hygiene, and health management prevent most problems before they start. Paratyphoid is beatable. It's not a death sentence for your loft. With proper diagnosis, treatment, and prevention, you can eliminate it and keep it out. But you have to know it's there first. Test your birds. Knowledge is power, and in this case, knowledge can save your breeding program and racing results. If this video convinces you to test your loft, please share it. Paratyphoid is massively underdiagnosed because most keepers don't know to look for it. Your sharing could help someone identify and eliminate a disease that's been destroying their results for years. Comment if you've dealt with paratyphoid and share your experience. And subscribe to Pigeon Healthy for critical health information that protects your birds and improves your results. Thank you for watching. Test for paratyphoid, treat it properly, and watch your loft transform.